Hello everyone, I'm Sanchika. I'm from Eco India. A very warm welcome to all the participants who have joined here today for the session on tobacco control webinar, who is the topic 8 for establishing tobacco-free schools in urban slums in India. So our chief guest for today's session is Dr. Sunila Garg, who is the Professor of Excellence Chair Program Advisory Committee, National NIHFW, and also our subject matter expert for today is Ms. Tshering Bhutia, who is the Vice President, Preventive Health Program, Salaam, Bombay Foundation in Mumbai. Now, I would request Mr. Arun Verma, who is the Director of Finance and Operations in Sipher, for the welcome address.
Yeah, thank you, Dr. Sanchika. I am Arun Verma. I'm from Team Sipher. I'm extremely delighted to welcome our chief guest, Dr. Sunila Garg, Professor of Excellence, Chair, Program Advisory Committee, NIHFW, Delhi, and Ms. Tshering Bhutia, Vice President, Preventive Health Program, Salaam, Bombay Foundation, Mumbai, who is the resource person for today's webinar. We are extremely grateful and thankful to Dr. Sunila Garg for accepting our invitation to be part of this webinar on very short notice. I also thank Dr. Kesh Gupta, President Sipher, Professor Sonu Goyal, RCTC PGI Chandigarh, who may not be able to join, being maybe he's away. And I also welcome Dr. Sanchika Gupta, Manager Project ECHO India, Mr. Rajiv Chaudhary, who is a program coordinator with Resource Center for Tobacco Control, PGIMER, and our eminent participants and public health students. As you all know, Strategic Institute of Public Health Education Research, it was established in 2018 with the fundamental purpose of creating a specialized public health workforce that can plan, execute, and monitor national health program and public health initiatives for tackling emerging public health challenges. We are working on all public health issues with a special focus on non-communicable diseases. During the last 5 years, we have organized more than close to 100 physical as well as virtual workshop consultations. We are working in complete coordination with the Resource Center for Tobacco Control, a joint initiative of the PGMR Chandigarh and the Union Southeast Asia. Is an emerging and one of the most sought after platforms that showcase tobacco control initiatives, updates, policies, resource materials, etc. from the length and breadth of the country. It has helped in strengthening the national control tobacco program to a large extent. I once again welcome and everyone who is joining this seminar, including our chief guest and the source person and all the participants. Thank you so much. Over to Dr. Sanchika.
Thank you, sir. Now I would request Dr. Rakesh Gupta, sir, for discussion on the objective of the webinar.
Thank you, Dr. Sanchika. So I'll be talking about the objective on behalf of Professor Sonu Goyal, who is away to Jodhpur for an assignment. So the Resource Center for Tobacco Control under the Department of Community Medicine and School of Public Health, PGI Chandigarh, they organized a national conclave on best practices under NTCP in India, with an aim to compile various initiatives undertaken by the states and document it at national, sub-national level, with respect to empower and NTCP for effective tobacco or nicotine control. So 25 practices in tobacco nicotine control from various states of the country have been identified as best practices in terms of its outcome to strengthen the tobacco control in the specific region or the community. And a couple of days ago, maybe 7 days ago, they have also issued a second compendium of the best practices. So we'll be continuing with this webinars. So Sipher was a collaborator in this event, and these case studies, they cover almost every area related to tobacco control, from advancing leadership and management in tobacco control in India to changing taxation policy on tobacco products in the country. The presentations by experts will help in increasing awareness and facilitate cross-learning among the stakeholders for strengthening the national tobacco control program in the country and sensitize the stakeholders on best practices for its application. Today's topic and the speaker are establishing tobacco-free schools in urban slums in Mumbai by Ms. Tshering Bhutia. She is Vice President, Preventive Health Program, Salaam, Bombay Foundation, Mumbai. So over to Dr. Sanchika.
Thank you, sir. Before moving to our presentation by our subject matter expert today, now I would request Dr. Rakesh sir for introducing our guest speaker. I will just showcase her bio brief. Just give me a second.
Okay. So Ms. Tshering she has over 18 years of experience. Can you show me the slide of Ms. Tshering?
Okay, sure, sir.
Yeah. So she has over 18 years of experience in the social development sector, and she's a seasoned professional with a proven track record in designing, planning, and executing impactful social development projects. So her vast experience to develop strategic planning and scale successful programs, coupled with a dedication to social development, makes her an invaluable asset in creating sustainable and meaningful change within communities. So as I already told you, she is Vice President, Preventive Health Program in Slum, Mumbai Foundation. So I'll request her to please make her presentation. Thank you.
So I'll start there with the permission of the
Sure.
chair.
Yeah. Can I
Thank you so much.
words before?
Yes.
Dr. Sunila will request you to comment upon her presentation. So after that,
Okay.
thank you. Thank you.
So shall I start then, ma'am?
Sure.
Okay, fine. Thank you so much. First of all, I would like to thank you for the opportunity. And I think I was also the part of in that national conference where the compendium was being prepared. And that was a great experience. And I think it is a great platform where we are given an opportunity to share it with the other partners also and other people, and it definitely can be replicated. So today I have been asked to speak on how we establish tobacco-free schools in urban slums in Mumbai. Now, before I take it ahead, let me tell you that in the entire presentation, I am going to talk about that why do we focus on making schools tobacco free, number one. I will also talk about to make schools tobacco free, what are the various kind of activities that we did to attain maximum compliance with TOFI guideline. I will also talk about the challenges that we faced and what were the various kind of activities that we conducted or the strategies that we or the tactics that we utilized to overcome those challenges. And finally, I will also talk about the recommendation that we have for TOFI implementation. Next slide, please. Yeah, thank you. So, Salaam Foundation started in 2002, and as we are saying that we are talking about that why tobacco-free school, why we are talking about tobacco-free school. So, we started in 2002, and I don't want to talk about that why we are talking about tobacco control among children, students, and schools, because we all know there are so much of data available nationally and internationally. I will not talk about data, but let me definitely emphasize on the fact that the children are our future of our country, and it is very, very important to generate awareness among them so that we can keep them away from consuming tobacco. This is very, very important. For that, awareness has to be created so that they are empowered to take proper decisions, especially with regards to their health, which will of course keep them, better and then make their future bright. Now, when we were doing this session, Salaam Foundation works mostly in urban slums, and in Bombay, we reach out to more than 400 schools, reaching out to around 50,000 students every year. Especially, we cater to the students who are in 6th, 7th, 8th, and 9th standard. Now, when we started with the awareness session. We went to the schools, we conduct sessions, generating awareness on what are the ill effects of consuming tobacco, be it a long-term effect, be it a short-term effect, what are the various kind of laws which they can use to prevent themselves from falling into the tobacco industry's tactics and strategies and marketing. But at the same time, the challenge was that though we were definitely talking about which would increase their awareness on effects of tobacco. At the same time, the challenge was that we were not able to give them or create an ambience which would allow them to keep themselves away from tobacco consumption. So, for example, entire 8 hours when they were in school, we were talking about ill effects of tobacco. We were increasing their awareness level. We were empowering them. But as soon as they step out from the school or just outside the school, or in fact at that point of time, also within the school, there were teachers or staffs who were consuming tobacco. And as soon as they step out from the school, there were so many tobacco shops, correct, which were selling tobacco products. And as you know how tobacco industry is, what their marketing tactics are. There was so much of products in, and the packaging was also so beautiful that children would get attracted to those kind of products. And therefore, we realized that it is very, very important to work towards tobacco-free ambience for the students. So, what should we do? At least we should start creating tobacco-free schools. It should be made mandatory. And that is when Salaam Bombay Foundation started working towards creating tobacco-free school. We started such kind of initiative. In fact, when we started, definitely we were not so streamlined, and then we just talked about, okay, fine, make your schools tobacco free. But we realized that it will not work if we do not streamline it. And therefore, in the year 2009 and 10, we adopted the tobacco free school guideline, which was released by CBSE at that point of time. It had 11 criteria. I'm going to explain those 11 criteria and now the toffee guideline 9 criteria, because I'm assuming that most of the people who are attending this are aware of toffee guideline and what are the criteria. I'm only going to talk about that how we are struggling or how we are making different efforts to comply with that toffee guidelines right now to make schools tobacco free. Now, by 2010 and 11, we also coordinated with the education department, especially in Maharashtra, and then after sensitizing them, there was a notification or a GR which was released by the education department, sending it to each and every educational institute, mandating them to make their school or the premises tobacco free and prohibit the use of tobacco. Though the letter was sent, but the moment was not so strong. So people were not talking about tobacco free educational institute. It was not a priority. At that point of time, we realized that we should bring in someone whose urge may be very effective. And at that point of time in 2011 and 12, what we did was we launched a tobacco free educational institute campaign, and then we started mobilizing people. Now for this, at that point of time, the then FDA minister, can you change the slide, please? The then FDA minister, Mr. Satish Patil, we identified him because he was very motivated. He was very sensitized already at that point of time, and he was keen to work with us in creating tobacco-free environment for the students and the next generation. And therefore, it was easier for us at that point of time to approach him, and then with his help, we would launch the campaign. At the same time, in Maharashtra, at that point of time, FDA was the agency who was the main agency to work for tobacco control instead of Ministry of Health and Welfare, Family Welfare, as it is in other states. But when you go to any kind of a stakeholder, you have to go with some kind of data. If you go with anecdote data, they will not listen to you, correct? And therefore, we did an immediate survey at that point of time before going to Minister Satish Patil. We did a very dipstick survey in around 91 schools to find out that how many tobacco shops are there around those schools. And as result revealed that around 75 schools had some kind of tobacco selling establishment in and around their schools, within 100 yards of the schools. And the number of shops that were selling tobacco products around the 75 school was 219 tobacco shops. So can you imagine, it is just more than double and triple. So those were the number of tobacco shops which was around the school, and no action was taken against those vendors also, as well as there was no display of any warning board in the shops also, as well as outside the school. So this was the situation, and along with this situation, we went and speak with Mr. Satish Patil and requested him to join us for the campaign, launch it. He agreed. Can you change the slide, please? Yeah, thank you. And he agreed. Tobacco Free Education Institute campaign was launched. Now, according to the campaign, there had to be a complete ban on sale of tobacco products within 100 yards of school premises in the entire Maharashtra, whether it is rural or urban areas of Maharashtra. There was interdepartmental coordination between FDA, NRHM at that point of time, Home Department, Education and Health Department also. Multiple meetings were conducted among these departments at that point of time. Certain amount of fund from NRHM was also diverted toward the campaign. As you can see on the slide, that various IIT materials were created, and for this funds were required. And with the help of Mr. Satish Patil, certain funds were diverted from NRHM to create such kind of IC materials. Salaam Bombay Foundation was responsible for creating prayers, oaths, and other kind of designing other kind of activities which would engage students and schools for the campaign. At the same time, an official letter was also sent from FDA and Education Department to the various educational institutes for the implementation of Section 6 of COTPA 2003. Can you change the slide, please? And the entire calendar was also developed for around 2.5 months of campaign to just mobilize and bring the momentum for tobacco-free educational institute. Now it started on 14 November, and as you can see on the slide, there were various activities which were conducted at educational institutes. It was made mandatory for them to do it. Within that given time period, they were asked to take oath. There were various kind of activities where the speech and essay writing competitions were held, drawing competitions were held. You can see there were slogan competitions. Now all these activities were there for around 2.5 months, which was supposed to be done by the Educational Institute to bring the momentum for tobacco-free educational institute campaign. Now, this entire campaign, we had the support of Mr. Satish Patil, and it was also hugely covered by media, and which really helped us bring the momentum for tobacco-free education institute. And this is something I'm talking about the year 2011 and 12. Can you please change the slide? Yes, this I've already spoken, so we can again change the slide. Yes. Now, when we were, of course, in 2011 and 12, we launched the campaign, but at the same time, parallelly, there are a lot of other initiatives were also being taken off. So, for example, as you can see on the slide, in 2002, well, what we did was we went to the local corporation. Let me also tell you that it is very complex in Mumbai. When we talk about Mumbai, there are various agencies who are responsible for the schools. There are so much of division and diversions. We have Maharashtra Education Department. We also have the corporation run schools. So schools are run and then is the responsibility of different agencies in Mumbai. So that also becomes very, very difficult. But however, in 2012, we went to Municipal Corporation of Greater Mumbai, who is responsible for running most of the municipal and government aided schools in Mumbai. What we did was, because we were talking about making school tobacco free, and our study had shown that there are more than 200 tobacco shops selling tobacco products within 100 yards of the school, we needed to stop it. There is definitely a rule which has come from the center of our COTPA, and under that section 6 and B, section 6A and B, which doesn't allow any kind of tobacco sellers in and around 100 schools. But you know, there is always a conflict between the central law and the state law. So generally, state machinery doesn't listen to the central law. So what we did was we approached this MCGM and we incorporated that particular law in the MCGM law of Shop and Establishment Act. Now, one of the best things which happened in this when the inclusion was happening was the penalty. Now, we all know that as per the COTPA law, if you do not or you violate section 6 and B, there's a penalty of rupees 200. Correct, which is very easy for the shopkeepers. They will pay 200 rupees. After 2 days, they will again open the shop. Now, when we included it into the Shop and Establishment Act of the Municipal Corporation, the penalty was the revoking of their license, which was very huge thing. Correct, so they would not take that risk. And therefore, this worked for us. That was one of the best things that we did. Now, as the campaign rolled out, there in most of the schools in Maharashtra, including urban and rural, there had to be a reporting system. And now how do we monitor that whether it is being implemented or not? Now here we again coordinated with education department, and fortunately education department included it into the monthly reporting system of the education department. So any reports which come from any district or any principal or any school in the state, it needed to also give the details about the 11 criteria for tobacco free schools. So that was one thing which was also happening. Again, there were certain other things which needed centralization, which would make the state government easy to monitor, and therefore SCRT also included the 4 criteria especially, which would promote tobacco-free schools, especially COTPA section 6A and B. The status of that particular thing was also included in Saral portal. Now, Saral portal is an online system of gathering information on schools located in different parts of Maharashtra, and it is filled in by all the principals. So that is Saral portal on which the data were updated, and then definitely it was sitting over here only. The department would easily come to know that what is the status of the school. Similarly, it also was included in the UDICE. So UDICE also had 4 or 6 questions which allows the principal to know all the status of the tobacco-free school. So UDICE and Saral are there. In 2015, Education Department again, of course, released another GR making it mandatory for schools to have tobacco-free school board, which is there in the TOEFL guideline, but is not being followed. Now, while the GRs and most of the things were being done at the same time, there was also advocacy going on to include chapters in syllabus or books of the students which could talk about the ill effects of tobacco. And I think that advocacy was well enough, and then the authorities were well sensitized, and therefore in 2015 a chapter on tobacco control, along with the various kind of activities that would engage students in generating a more awareness of on tobacco control, as well as disseminate the message. Those activities were also included in those chapters. So in 2015, there's some typo error, but in 5th and 6th standard environmental science, the chapter was added. Similarly, in 2017, it was added in general science and science and technology for 7th and 9th standard. In 2018, chapter was added in general science and science technology for 8th and 10th standard. And 2019, there's a subject called Bal Vikas for 11th standard. Chapter was added in that particular subject. And 2020, it was added in sociology subject for the 12th standard. So this all were also interventions which was happening simultaneously, which added value to make more schools tobacco free and comply with the TOEFL guidelines. Can we change the slide, please? Yes. Now, when I'm talking about the guidelines where we were trying our level best for the schools to comply with TOEFL guidelines, now there was an issue of reporting, that how do we monitor it? So in the beginning with Salaam Bombay Foundation also, when we were asking them to send the report, it was difficult for us also to go and then visit each and every school to monitor with the limited resource people. Number one. Number two, when they were sending it, it was difficult for the teachers and the principals also, because then it was a manual thing. There would be a huge report. They had to click pictures, they had to paste it on the paper, prepare entire document and then courier it to us, which was a tedious job. And as a result, we may not be receiving the amount of reports that we were expecting. And therefore, in the year 2015 and 16, Salaam Bombay Foundation launched a tobacco-free school mobile app. It is free for the teachers, and so this is a mobile app in which they have a ID, unique ID. So unique ID is a UDICE ID which has been given by the government to each and every school. So as soon as they put the UDICE number there and their passport, an entire question with regards to the status of TOEFL criteria is seen by the principal or any nodal teacher who has been appointed to take care of TOEFL guidelines compliance in their own school. So these are the criteria which they can upload immediately. If they have a picture of displaying board outside their school, they will click immediately upload it. So all the status is updated over here, and one button their report is over. So there is not much of the much of tedious job for them, as well as it is easier for us to monitor, because without going there we can monitor, we receive the report, and at the back end we have a team which sits and then which also validates the report whether it is right, wrong, and then finally it is accepted and whether it is really a completely tobacco free school or not. So this entire system was really, really helpful. Technology was really helpful in monitoring and evaluation of top implementation in the state. Can you change the slide, please? So also, I would like to mention that recently we have signed an MOU with Health Department, which has made mandatory to use this particular app, especially in the state of Maharashtra, to report toffee complaints. Now, this is the thing that I spoke right now is all about the various kind of activities or the initiative that we have taken to bring a momentum for tobacco-free schools, to create ambience where we can talk about the need of tobacco-free schools. But while doing so, there were various learning and challenges. Number one, as you can see, was seeking involvement. So what happens is to bring teachers and principal on board was very, very important, because for them there are so many other things which is important in their day-to-day life. For them, making school tobacco free is not important. So how will you do it? Correct? Because we have toffee guideline and it is our interest, we are working on the subject issue, doesn't make important for them also. So we had to go back to them, and Salaam Bombay Foundation believes in persistent. We have consistently been doing work, whether we are being funded by some organization, whether we receive any kind of fund from government or not, it doesn't matter. We work for the cause, and then we have been doing it continuously. And that's the reason why we have an entire program in this. Our entire module is like that, where we have been sensitizing teachers, trying to bring them on board. So every quarter we have a team which goes back to school. We do workshop and sensitization meetings with the teachers and principals who are involved in the process of making schools tobacco free. We try to sensitize them to make them realize that why making tobacco free school is important, why it is important to save our future, why it is important to save our students who are our future by before they get into the strategies or the tactics of tobacco industry, they get into the trap of those particular strategies. So once you sensitize them, once you bring them on board, once you make them believe that it is for the future of the children, it is not our job as an NGO, it is not not for us, or as a government, it is not for government, it is for the children and future of the country. Once you make them believe that, once you convince them, they always come on board, they are very, very supportive. So that is something that needs to be done on a regular basis. Now, here also, when we started implementing, despite convincing them to take initiative on creating tobacco-free schools and complying with all the toffee guidelines, there were other challenges also. So in the beginning, there were 11 criteria for toffee. Now there are 9 criteria. Howsoever, it doesn't make much difference. All the 11 criteria has been included in 9 criteria also. But it was not so easy for schools also. They also faced many challenges. And then for an entire year, to maintain that sustainability of being a tobacco-free school was also very difficult. To start with, it was difficult for a school to comply with all the 11 criteria at one go also. So there also we used our strategies. What we did was we divided those 9 or 11 criteria into 3 buckets. Those schools who would complete around 3 to 4 criteria, we would call them we would call them and make them fall into bronze categories. Those who would complete around 8 to 9, we would put them into silver, and then those who would complete entire 11 criteria, we would put them into the gold category, hence declaring them as a completely tobacco-free school. However, those schools who were in bronze category and silver category, we would say that okay, fine, that they are in the process of making their schools completely tobacco. The second very important challenge was the lack of funds. So whenever we used to go to the principal, as we all are aware, there are criteria in the toffee guideline where it is said that you have to display a board. So you have to create that board or paint the wall, correct? Or do the yellow line. Now it doesn't happen for free. They have to invest some money to buy those materials and then paint the walls or display the boards, correct? So principals would always come back to us and then say that we do not have money to create such kind of materials. We do not have money to paint the wall. And this was a challenge for us. And as a Salaam Bombay Foundation, as an NGO, definitely to certain extent we helped them. How did we help them was, one was for the premises of the school, which was inside the school. We would go to the school, we would conduct various kind of drawing competitions. The topic would be various topics on COTPA related to tobacco control, and whosoever the winner was, we would pick those posters, laminate them, and then display it inside the school. But as far as the wall painting and other things are concerned, and being an NGO also, it is also not feasible for us to every time fund them with such kind of thing. Correct? So we had to think of alternatives. Then what we started doing was, we started identifying local leaders in the community where the school was established. We started looking for local leaders, whether it is political or any other local leader, and we would create an association between the school and that local leader, and local leader would sponsor certain materials and money for the painting and the posters and creating boards for the schools, and that is how we were able to tackle and handle this particular challenge. The third one is a communication gap. Now, there is a major communication gap between the department, because when we talk about making school tobacco free, it is not so easy. There are a lot of things, especially a lot of interdepartmental coordination has to happen. Now, when we talk about tobacco free schools, we are talking about schools, correct? And schools fall under education department. But remember, the TOFI guideline has not come from the education department. This has come from the health department. So why would education department, people who come under education department would follow the policy which has come from the Ministry of Health and Family Welfare? And therefore, here also Salaam Bombay Foundation and of course other NGOs in other areas. Here we did as Salaam Bombay Foundation, but it is our strong belief that other NGOs in other areas play a very important catalyst role in such kind of momentum, where we have been closing that gap, whether it is a communication gap or a coordination gap between the departments, and bringing everyone together just to comply with, just to have more compliance with the TOFI guidelines. So that is also very, very important. There has to be an interdepartment coordination. Otherwise, it is very difficult to have TOFI guidelines or complete compliance of TOFI guidelines. Now, number fourth is difficulty in sustenance. Now, when I say difficulty in sustenance, it is not a one-time job. Correct? So we go to one school and say, okay, fine, you have to follow a TOFI guideline. Maybe that school agrees, and for that year or for that particular 2 or 3 months, when you go and then monitor them, you see that all the 9 criteria of TOFI guidelines has been complied with. But after you go after 3 or 4 months, you will see that 1 or 2 criteria is not fulfilled, or they have already lost, or maybe there is no board which is being displayed, and therefore regular monitoring is required. And also you will have to create such kind of nodal teachers or students like health monitors, which we have done in our case in the school, who would also monitor the sustainability of the compliance of the guideline. Salaam Bombay Foundation, because we are there, we do not leave the school immediately. We are always there in the school, and therefore monitoring is continuous, and that's the reason why that the compliance rate is quite high in our case. So that is about sustainability, and we also have health monitors. So what we done is, as I already said, that we have sessions and programs going on in the school. So when we go to the school after our sessions and programs, we also equip our students who are in 8th and 9th standard with the leadership skills. We encourage them to work for the community. We encourage them to work for the schools, and therefore we make them a health monitor to evaluate and to monitor whether certain criteria to make their school tobacco free is being followed or not. So this is really helpful for us, and this is how it has been really helpful for us to sustain the TOFI compliance in the schools that we are doing. Can we change the slide? So now coming to the end with our learnings, of course, of so many years, we would like to recommend that TOFI guideline, for the compliance of the TOFI guideline, it has to be a mandatory policy. Right now, we must accept this, that it is just a guideline where you are still living that gap where the school may or may not adopt the guidelines, correct? So once it becomes mandated by the education department, I think the compliance of toffee policy will be much more in comparison to when it is just a guideline. The second one is that as I said earlier, there is some financial issues in the school. So in the guideline where we have asked to make so many materials for displaying and to put around the schools, I think we should also provide certain financial help. It may be minimum, but certain kind of financial help should also be given to the schools to make such kind of materials, then displayed at the school level. Use of technology, as I said, though we have a guideline, but we also need to have a robust monitoring system, which is not only convenient for us to monitor, but also the teachers who would update their status. This would really be helpful. The fourth one is, as I said, because we are talking about tobacco-free schools, our major stakeholders are school people, correct? So whether it is school principal, teacher, or school staff. But their awareness session is, I don't think that there is much of workshops and the sessions conducted from the department itself. In Maharashtra, we have been conducting such kind of sessions. We have been conducting such kind of workshops, sensitization workshops for the teachers every quarter. So if that can also be done by the ministry, I think that will really be helpful. And the last one is there should be some kind of incentive for schools to motivate them. You just can't go to school and say, okay, fine, make your school tobacco free. The first question will be, how will we benefit? What will be benefit? Though we have been saying that it is for the future of the children, but until and unless school authorities or principals see any kind of benefit for their own institute or for themselves, they would not come ahead. When I talk about incentive here, I'm not talking about the financial incentive. We can have an incentive like where we can felicitate the teacher as one of the best teachers, one of the best schools, or we can have some kind of accreditation for the school at the accreditation from high state or national level education system, where the school gets a special position or a designation, which of course will work as a motivation for the schools to make their schools tobacco free. So this is all about tobacco-free schools and our experiences. I'm open for the question. Thank you so much.
Oh, thank you, Sharing, for the excellent presentation. So I think the buzzword is catch them young. So we all know that in tobacco control, once a person starts using tobacco, it is not easy to quit. So it is better to sensitize kids, adolescents, when they can be told about the health effects, and they definitely would also ask their family, their friends to quit tobacco if they have already started. So excellent presentation. So I will just request our chief guest, Professor Sunila Garg, to make her comments, please, on the presentation.
Thank you, Dr. Rakesh, Dr. Arun, and thank you sharing Bhutia for sharing such an excellent work, because this reminds me of my ESTA project, that is addressing smokeless tobacco in Asia, where we also this project just finished a few months back, and this was a NIHR funded project where we also looked at the schools, the classes 6th, 7th, 8th, and we also looked at the vendors part of it also. And I know that when you talked about a lot of problems, and then you built on an intervention, and subsequently you went on to addressing the challenges as well. And you rightly pointed out that it is not an easy task. As I was looking that after establishment of your Salaam Foundation in 2002, to 2011-12, where you started, tobacco free initiative, I know that, it is quite a bit of task, because you see, addressing tobacco is not a priority for the schools. As I know, when my teams went, they always said, madam, actually, they say we have no time for teaching the children about tobacco education. And the important part which you said, and which really echoed with my this thing also, and one of my PhD students was also working on that, the teachers themselves smoke, they themselves consume smokeless tobacco, and that is where it is accessible, and the students are following them. So that is another important issue which we need to, kind of look at. So the persons who are their mentors, unless we kind of, empower them with correct knowledge, that is another very, very important thing which needs to be kept in mind. So whenever we are doing any strategy, apart from looking from the vendor's perspective that they should not be within 100 yards, they should have, licensing part, they should display, very clearly and all that. And in fact, the schools also should have a clear display material, but also our teachers, they need to be kind of, empowered with the correct knowledge, because that is something, which is very, very important. And another thing I'll say that, one thing which you rightly followed all these protocols. In addition, we also took consent of parents also. That, it is important to look from that perspective that, once they are, what we are talking to the children, what information we are obtaining regarding children from the parents and all that. So they also in return become well aware of, the kind of, the hazard which is being posed by tobacco. And also I said that it is very important to not only look at the health perspective, it is also important that, when you talked about education department and when we were obtaining permissions with regard to, conducting, this kind of work in schools, it is not a priority for education department, not a priority for teachers. So this is where we need to kind of bring about a moment where, we have the education department in the loop, and along with that, we need to have a multidisciplinary, multi-sectoral, multi-ministerial involvement. So that is where together we can address this whole thing. And I also feel that, the capacity building of everybody, whether we talk of principals, whether we talk of teachers, whether we talk of, students, and, even our humble, employees who are there within the school. In fact, everybody needs to be kind of involved into the whole thing. Another thing which is very important, even if they are beyond 100 yards, sales to minor by minors is another important issue which we need to keep in mind. So that is where we need to see, because in front of you, there will be a person who is there, and he will, kind of not even bother to ask about the age of the child and all that. But it is important to look from that perspective also, because when if you continuously watch these vendors, you will realize that most of this product, whether smoke product or smokeless product, to these children, which is again, a point of concern which we need to keep in mind. But really, it was a very, very challenging activity which you undertook, and this will prove a kind of a replicable and best practice for other schools also to follow, because the area itself has been quite challenging, because you did this work in slums of Mumbai. And I know with my own research work of so many years that how difficult it is to, kind of work in slums. First of all, the population is also, not very consistent. It is difficult to follow these children for a longer period of time. I congratulate you for this work, and I feel that, it is important to carry on with this message across. And definitely it is one of the best practices which you have come out with, and which will pave a way for, the other interventions in the regular schools, that means beyond the slum areas. And we need to not only look at slums, we need to look at the rural area, urban area, and now we have got the tribal part also, which is constituting 10% of our population, because they are not very particular about whether their children are consuming smokeless tobacco and all that. So these are some of the important issues which we always need to keep in mind when we are talking about, when Dr. Rakesh used this punchline, catch them young. It is very important. And also catch the parents, catch the teachers, because you see, these are our role models and students are going to follow them. So that is where it is important that we need to have a very vigilant, kind of a person, whether it is a teacher, whether it's a parent, and who is an empowered person. And we need to have more focused discussions with the teachers, to see that what do they feel about that. Do they spare some time? Do they have time? Within what curriculum, within what time they will have, I'll say that the time for this activity with children, because we need to come out definitely with the innovative activities, as you yourself said that in 2011 onwards you had poster competitions, you had different activities. So it is important to look from that perspective also. So overall, I'll say that it has been a challenging and testing time, but you have been able to achieve what you wanted to do that. And I'm sure that these practices will be scaled up to the other parts of the region, and then subsequently to the rest of the states. Thank you so much. If there are any questions, we'll be happy to take that.
Thanks a lot, Dr. Sunila. Actually, I may tell all the participants that Dr. Sunila, she has a professional and research experience of 43 years, and she has been ex-sub-dean and head community medicine, MAMC head FMS Delhi University, and she has been national president IA PSM in 21-22. So I think she made very valid points. And I'll request Dr. Sanchika that we have some tobacco control stalwarts among the participants. So can you just call them and ask them for their brief comments, very brief.
Sure, sir. Sure, sir. On the first, I would request Dr. Rakesh Gupta, sir, from Rajasthan Cancer Foundation. Sir, would you like to make some comments on the presentation today and add some? Thanks.
Thank you, Dr. Sanchika and Sipher, for inviting me to give some comments. I think this has been a masterly presentation, and hearty congratulations to Salaam Bombay Foundation. And I think they have done a great work. It's a initiative that I have known for very many years. And I know it's not easy to do the innovations which they have done. And the achievements have been really very remarkable. So my best compliments to Tshering and her leadership and the entire team for doing what they have done for Maharashtra. And I'm sure it has already made impact in Maharashtra amongst the children. And I think I will second Dr. Sunilaji's comments all through. Sentiments have been there. And I think those are very, very important comments. Our experience is so very remarkable that I really don't have to repeat what she has said. But I would definitely like to say that, yes, we are all grappling with the tobacco control situation overall in the country. And I think the prioritization is missing at the multi-stakeholder level. And I think our major challenge here is how do we mandate what is given as guideline, and how do we get the resources, particularly the financial and resource, which is very much important, because whenever you go to the micro level working, naturally the human factors start playing in, and one of the need is how do we incentivize the people to make a change. It's not easy to bring the change in. And therefore, I think there is a need to consider, I think everywhere throughout the country, is that we need to make a shift in our own tobacco control standing to think of elimination of tobacco. That's one challenge we should take, and I think I am talking about going a step further from tobacco control and making the tobacco-free educational institutions, therefore, is the right strategy, because that will reduce the number of the initiators into tobacco use. And I think tobacco-free generation needs to be talked about as well for the tobacco-free educational institutions along with. And I think that may perhaps be a right input or integration which is required into tobacco-free educational institution. Way back, maybe a year ago, I had talked to our joint secretary, had led one of the tobacco-free educational institutions webinar. And I did mention that the weakness in tobacco-free educational institutions is that it doesn't give potential for the current users amongst the adolescents to quit tobacco. He did say that, yes, you give the inputs, and I did provide him some lead points. I think there is a need to connect with the National Quit Line or AM suggestions so that these students can be benefited, those who are current users of tobacco, because we need to reduce their population within the schools. And maybe not only the students, but the teachers also who are users of tobacco. So I think these are some of the observations that I have made, which may be very useful. Tshering has led the initiative countrywide. I think they have done a great job. So my hearty congratulations to her again, and best compliments to Dr. Sunila ji for giving the leadership at the national level to all of us. Thank you, Doctor.
Thank you, sir. Now I would request Ms. Susan Sampson from Faith Foundation for her comments.
Thank you so much, Sanchika ji, Dr. Rakesh, for giving me this opportunity to share my views on the same. I want to reiterate and I want to second the idea of Dr. Rakesh Gupta. I love his passion whenever he talks about a tobacco-free generation, and point blank when he says that, you know, we need to start talking about the end game. So I really see TOFI as the only device or the only module or the only strategy wherein we can ensure that the future generation is actually not a victim or does not even initiate. So my strong suggestion would be now that all the school, well, in Gujarat, we do not have still TOFI sort of integrated with school awareness program under the NTCP. So it's like the school awareness programs are done on its own and TOFI programs are done on its own. But I believe that now our NTCP program should call all the school awareness programs or stuff like that as TOFI programs only, or as Dr. Rakesh Gupta is suggesting, that these should be now called as tobacco-free generation programs exclusively. Because I believe unless and until we don't start talking about the end game or the tobacco-free generation now, we are not going to see it in the next 5, 10, 20 years, or whatever the struggle of getting a tobacco-free generation happens to be. So once again, I would like to congratulate Madam Tshering for an excellent data-based, very well use of internet or the use of technology-based school programs that is run by Salaam Bombay Foundation. And I believe that this is how we need to replicate it in all of India and ensure that, you know, all of our schools are actually striving towards tobacco-free generation. Thank you so much, Sanchika, once again. Thank you.
Thank you, ma'am. Now we request Dr. Anuda for her comments.
Yeah, thanks a lot, ma'am, for the valuable input and like sustainability of the project like you have taken. And it's a very challenging thing to go for a tobacco-free school initiative. And one query I had was many of the times even the location of the school also keeps migrating. So nowadays we find the schools in the commercial areas as well as seeping into the residential area also. So how to go ahead with the tobacco-free school initiative where there are already established pubs are there, bars are there, and cigarette shops are also there.
To be?
Yes,
yeah, like.
Yeah. So we have already been facing that, Aruna, because then, as I said in the beginning itself, the urban slums of Mumbai is very, very difficult, correct? So urban slums of Mumbai, the school infrastructure is not as you will get in the rural areas. Even the rural areas infrastructure, school infrastructure is better than the urban slum Mumbai infrastructure, you know. The boundary wall of the schools, they are the wall of the kitchen of another household. Okay, and as soon as they get out of the gate, there is an entire row of shops which is selling tobacco products and other products. Correct. So this is something that has been challenging for us, and as you correctly said, that it becomes very difficult. So what we did was, we can't go out and then we can't say, we tried that first, correct, to begin with. We said, okay, fine, there's a law, you can't just have your shop within the 100 yards of educational institute, you can't sell tobacco products here. But then of course, it is also their livelihood. They would not leave their shops and then go back. So what we did was, as I said, that our program is a very consistent program that we have been running in schools since 2002. So we have our health monitors. As I said, for the sustenance of the program, what we do is we have empowered our students, correct, and converted them into the health monitors who talk for themselves, who talk for their own rights. So these are the health monitors now. Again, they are going to those shopkeepers who are selling tobacco products within their the premises of the school or just outside the school within 100 years, they go and they are sensitizing the tobacco selling vendors to not sell tobacco products at least within 100 yards of school if they really want to operate within that school. And it has really worked for us because then we have also conducted various studies. The studies has also been shared with the agencies who take action. So there are 2-3 things which happen simultaneously. One, we report the violation to the agencies, and agencies comes and take action. Number one. Number two, of course, our students goes and then try to sensitize the tobacco vendors for not selling the tobacco products, even though if they can have shop, if they want to run their livelihood, they can have shop, they can sell other products, but they can't sell tobacco products. So these are the various things. We are also, our kids are going, health monitors we call them, they are also going and sensitizing them on pasting the board which says that the minors are neither allowed to sell tobacco products nor it is allowed to be sold to them. So those are various strategies that we are applying and trying to bring this menace down. But yes, it is challenging. It is very, very challenging. It is nothing new for us, but then it is challenging, and we have been using various kind of strategies to bring this down.
Because this was brought by the school authority themselves when we were giving
Yes.
lecture on the tobacco free school initiative.
Yes.
Like,
yes, because as per CORPA, you will see there is a violation. Principal is the authority who can go and take action, correct? But there has been cases where principals has come to us and say, I can't, because it is Bombay. There are certain areas, it's a good area. Good, when I say good, it's a Gunda area, correct? So the principals are very scared to take any action. Once I tell you, one principal has told me, madam, if I will say something to this student in the evening, I cannot go out of my school. Why? Because that boy will be standing outside with 3-4 more Gundas. So these are the things where we have been helping principals and teachers, where we have been saying principals, okay, fine, you just write a letter. We will be the one who will be helping you to take that letter to the police station, and police will come and then take action. So there are various things. It is nothing like a cookie cutter. We don't have that thing. It has to be handled from from situation to situation. So there has to be a different strategies for different situations. That is what all I can say. That is what we have been doing. There is nothing like cookie cutter for everything.
ma'am, like how the children who are tobacco users were addressed. So like many of the times they feel that they are being stigmatized and they find difficult to even to access the healthcare professional for cessation and other things.
Very true, because this was a small presentation. We have a time limitation, and that is the reason why I could not explain our entire program. But Salaam Bombay Foundation's model, which is we call Preventive Health Education Program, our program is called like that, and it is for the students. And we are running it since 2002, correct? So we know every bits and bits of the adolescent, and there are adolescents, of course, who are consuming tobacco. But you know what my challenge is? Our challenge is, the challenge is that despite we knowing that that child must be consuming tobacco, we can't make him say that, okay, I consume it, correct? For example, it's a law. If he is saying he or she, they don't voluntarily accept that I consume tobacco, despite me seeing him or her consuming tobacco, I can't just say that, okay, he or she consumes. That is the biggest challenge, one. But we know, because we work with them on a day-to-day basis, we are aware that how students are consuming, what their habits are, what they are going through. But how, as you said, we have been very, very careful since beginning that there should be no stigma and discrimination for those students who are consuming. Correct? We identify them with the help of our own facilitators, because our facilitator go to the school on day-to-day basis. They can identify which student consumes, which doesn't consume. Teachers are also very helpful in identifying those students and reporting it to us that these are the 5-6 students who are consuming. At the same time, we of course, because they develop such kind of relationship with our facilitator, once they develop their confidence in our facilitator, there are students who themselves come and then say, okay, ma'am or sir, I have been consuming, but I really want to quit. Help me. How should I do it? So these are the cases which has happened with us. And there are principals who have also come and requested us to conduct our cessation program over there. Let me also tell you that Salaam Bombay Foundation also runs a cessation program, which is called Life First program. We run it for the school students. And the protocol is entirely in such a way that the stigma and discrimination doesn't need to happen. It is done on individual basis, because we know there will be a lot of stigma and discrimination going on. So those are all the things we have considered and taken care of. But as I say, we have not been able to eliminate it completely. It can't be so easily, correct? But we have been trying to look for solution for each and everything that we face on day-to-day basis, or everything that we learn from day-to-day.
So,
Thanks a
Dr.
lot.
Tshering, I'll just request you to please share your email ID in the chat box so that anyone having more queries can just ask you directly. And before that, I think we'll just ask Dr. Sanchika, please ask everyone who wants to make comments amongst the stalwarts, just to stick to 30-second timeline.
Sure, sir. Now I would request Dr. Ram Prasad for the brief comments.
Yeah, thank you so much, madam. Very grateful to you for the opportunity. Madam, it was really a very insightful presentation. I just had one query and observation. Madam, actually, I'm trying to focus on single teacher schools. A few schools have been identified in every district as single teacher schools. That is, there's only one teacher taking care of all the educational needs of the children. So it's quite challenging. So any such examples and any insights into handling of such schools and tobacco cessation and making such schools tobacco free would be very helpful, ma'am. Single teacher schools. There are quite a few schools in every district. We just have one teacher handling almost all the subjects. The government schools and some are aided schools, because of so many resource crunches and deficiencies, they're just handling one teacher is handling all the subjects. So any such experiences, ma'am, will be helpful. Thank you so much.
So, Dr. Ram Prasad, we did not have such kind of experience. Definitely, we have experience where there are schools, there are very few teachers, correct? So, for example, maybe only 2 or 3, but we have not come across any such kind of school where there is only one teacher. Having said that, we have come across the schools where there are very few teachers, like 2 or 3, and one teacher is only taking all the subjects. One teacher is only taking English, he or she is only taking maths and all that.
Yes,
and that's
ma'am.
the reason why I told you, and that's the reason I told you that when we go to the schools, they themselves are struggling with their day-to-day responsibilities, correct?
Right.
That's the reason why tobacco is not a priority for them. But
Right.
for us, it is very, very important to sensitize such kind of teachers also, because they are in fact much more responsible, because they are the only one in that school and they can only guide those students. So I think those things has happened.
I think, Dr. Ramprasad, the same thing which we also observed in our settings, because this is not a priority. So simultaneously, it is important to empower the communities as well, and the healthcare workers also which are there, because school settings are not receptive, because they say that we have to finish with the curriculum. We don't have time for all these activities. So that is where you can make your own effort. But these activities do not remain sustainable, as teachers are bound by a lot of other pressures also. So
Right.
that is where simultaneously, if you involve the communities, that becomes much more helpful.
Right. Thank you, ma'am. Thank you so much. Thanks a lot. Thanks.
Thank you, Dr. Ram Prasad. Now I would request Dr. Siddhi for her brief comment, and I also see she has a question. Ma'am, you can ask your question.
Hello, ma'am. I wonder, because many rural areas, parents give tobacco products to their kids for reducing hunger. So was this accommodated, like hunger thing in meal or anything else? Because midday meal program was not initiated in 2002 as it.
Yeah, Siddhi, this is a story that we have been hearing since long, and then right now today I was actually presenting the urban slums tobacco-free establishment. But yes, you are right. In rural areas, not in only in rural areas, but in urban areas also, there had been cases earlier which we had come across where parents who were unaware, of course, they would feed certain tobacco products or small, a bit of tobacco they would put in the mouth of their child so that their hunger dies. But of course, as Dr. Surina Garg was also saying, that it is very, very important to generate awareness among community members, the parents of the children, correct? And that is the reason why we have been doing it in so many years. And in so many years, maybe when we started in 2002, for 5, 6 years, or maybe 7, 8 years, we definitely faced such kind of issues and such kind of cases were highlighted more often. But now we do not hear such kind of cases, because I think the awareness about ill effects of tobacco in general, of course, has increased in the community, and especially the community that we are working in. And that's the reason why I said you that it is not only possible for the facilitators or the people of Salaam Bombay Foundation to go and disseminate such kind of messages. And therefore, we have empowered our students who are health monitors, who are going back to the community and creating that kind of awareness for their own parents. And I am especially talking about the underprivileged students whose parents are illiterate. And for them, it is very, very important to have such kind of awareness, where we are teaching those students, and those students are going back to their home and community and disseminating the messages, which is working for us.
Thank you.
Thank you, ma'am. We will take a last question which is in the chat box. I would request Dr. Sahana to please ask your question.
Dr. Sahana, are you with us? Dr. Sanchika, have you taken a snapshot of all the
Yes,
participants?
I've done that.
Okay,
So, Dr. Sahana, would you like to ask a question? This is the last call for questions.
Ma'am, mostly Salaam Foundation will get on site, na full project of yours.
Yeah. It could be there. But in any case, you have an email ID of Tshering Bhutia. So she'll be happy to answer all your queries on mail also.
So there's a question by Dr. Rakesh in the chat box. How satisfied are you with the political engagement in the state?
I was expecting such kind of question from Dr. Gupta. It's quite difficult for me to answer, but I will be very, very diplomatic. See, without their support, it would not have been possible. So there is a support, I will say. Without their support, for us running, such a huge program in school wouldn't have been possible. Certain GIAs and notifications, as well as inclusion of chapters in the books and syllabus would not have been possible for us if the government would have been supportive. But definitely, I will say that more support is sought after.
Thank you, ma'am, for responding to the question. Yes, there's a question by Dr. Sahana, which is left out. I will repeat the question. Were parents involved in this project? She's referring to your project. That
without parent consent, nothing moves. Before we start our program, forget about starting our program, started in 2002. Every year we take consent of parents. Without parent consent, nothing happens.
Yes.
Yeah. So, Sanchika, I think we can have a very brief comments from Professor Sunila Garg, and after that we can have a vote of thanks from Rajiv.
Thank you, Dr. Rakesh. I think it was a very, very innovative session by Dr. Tshering Bhutia. And definitely, there is a lot of scope for scaling up this intervention across the country. But this has to be very culture specific and, depending upon the sensitivity of the area. Because when we worked in the rural areas, urban areas, and I'm talking of state like Delhi, where, the challenge starts from, looking at the education department itself, where a lot of insensitivity is there. That is important part. But at every point of time, you must involve the local, I'll say, key informants, key leaders. That is important. But I must congratulate Dr. Tshering for such a beautiful initiative, and in that too in a difficult area, because working in slum areas is really challenging. It is one of the best practices which you have shared, which can definitely be scaled up depending upon the area and involving, the local challenges which will come in. But always, I think it is better to follow up these children also who are there in 5th to 6th to 7th and 8th, because after 8th, again, quite a number of children, they do shift. So I am really thankful for this, Dr. Rakesh, for having me in this program, and also, very thankful to Tshering for bringing out such an intervention, which is really challenging. Let me tell you, it's not easy, because having worked in this area, I knew that for 8 years we were stuck up, and in between COVID also came. So it's really challenging, but definitely it is possible with the help of dedicated team and all that. It involves a lot of effort, lot of queries, lot of challenges from the school perspective, political perspective, interministerial coordination and all that. So I wish you all the good luck. And I feel that this is one of the best practices which we can always replicate. Thank you.
So thank you, Dr. Sunila. And in fact, Tshering Bhutia's presentation has been appreciated by so many people. And we have close to 90 participants. So that shows that how much interest it has been generated. So thank you, Tshering. So over to Dr. Sanchika.
Thank you, sir. Now we move to the last part of the session, that is vote of thanks. I will request Mr. Rajiv Kumar, who's the coordinator for RCTC, for giving vote of thanks.
Thank you. Thank you for giving me this opportunity to propose a vote of thanks. I hope I'm audible clearly. I, Rajiv Chaudhary, on behalf of Resource Center for Tobacco Control and Sipher Chandigarh, extend my heartfelt gratitude to all the distinguished guests present here today, Thank you for joining us in this very informative webinar, Establishing Tobacco-Free Schools in Urban School in Mumbai. And we are deeply grateful to all our esteemed guests who generally shared their insights and expertise on this important topic. First and foremost, I would like to express my sincere appreciation to our chief guest, Dr. Sunila Garg ma'am, for gracing this presence and delivering an enlightening address. Thank you, ma'am, for joining us today. Our heartfelt thanks to our keynote speaker, Madam Tshering Bhutia, for exceptionally informative presentation on establishing tobacco-free school in urban school in Mumbai. It was indeed a privilege to listen to such an eminent speaker on this particular webinar. Special thanks to our experts, Dr. Rakesh Gupta from Rajasthan Cancer Foundation, Ms. Susan Samthang from Faith Foundation, Dr. Aruna Das, Dr. BP Ramprasad for their valuable comments in regards to the webinar subject. I would like to thank and congratulate to the organizing team led by Dr. Rakesh Gupta sir and Mr. Arun Verma sir for leaving no stone unturned, ensuring the success of this particular webinar. Lastly, a special word thanks to all the participants for their active engagement and valuable contribution to this webinar. I extend my gratitude and give resounding results applause to all of you for showing interest and making this event great success. And before we conclude, I urge all of you, if you require some additional information and various updates regarding tobacco control, please visit Resource Center website, www.rctcpgi.org for any type of information. So thank you all once again and stay safe. Thank you.
Thank you, Mr. Rajiv. Now, the last just 1 minute, I would like to inform you about the next session, which is on 2nd of August, Wednesday, same time, 4 p.m. The topic is establishment of National Tobacco Testing Laboratory in India, and our subject matter expert is Dr. L. Swasti Charan. So we will see you on next Wednesday. Namaste.
Thank you, Dr. Sanjay. Thank you. Thank you all. Thank you.